Great. So they have much lengthier and very impressive bios that hopefully they can tell you a little bit about while they're talking. And I just also want to note that Carrie O'Grady was going to join us as a presenter, but wasn't able to. So just thinking about her and wishing her the best. So I'll pass it over to you all.
Great. Well, it's wonderful to see everyone here. Thanks for coming. And we'll just roll right into it. It's good to see some old friends and new friends and people who I know are working in similar ways and throughout the field of mental health and public health. And so um, we'll dive right in. So this work has been a long process. I've been working on these competencies for quite a long time now. I think my first paper reporting on a study that started a couple years before that was in 2013. So now it's been about 15 years working on this. And just want to acknowledge all the teams who have worked on developing spiritual and religious competencies over the years for mental health professionals and psychotherapists. And Joe especially is such a valued colleague, and I'm so glad to be speaking with you, Joe. And I'm really grateful for Division 36 also carrying the flag all this time in psychology, which is oddly sometimes not the most friendly field for what we're looking at. So I'm just not going to be able to read all these names, but want to say that there are a whole lot of people who have been involved in the work that Joe and I are about to share. And Joe and I had the great pleasure of working with other principal investigators, including Michelle Pierce and Holly Oxhandler, Clay Polson, Kenneth Pargament, and Jesse Fox on the Spiritual and Religious Competencies Project supported by the John Templeton Foundation. And so if you scan this QR code or go to srcproject.org, you'll be able to reach us, or srcproject.com, and learn about what we've been doing over the last several years to see if we can equip mental health professionals with the competencies they need to address the religious and spiritual dimensions of people's lives. And so most of you on this call are well aware that spirituality and religion is not just sort of a niche topic for a minority of our patients. It really is a core aspect of many, many people's, a large majority of people's identity and their sense of who they are, their diversity, a core component of multicultural diversity and identity. It's associated with the same kinds of historical oppression and privilege at times that other aspects of diversity and identity have been associated with. And it's highly intersectional with other aspects of diversity, such as gender and age and region of the country, socioeconomic status. And it really is just inseparable from, in most people's lives, from who they are. And then also a core component of psychological functioning. So when we think about spirituality and religion, we're not only thinking about it as a diversity variable, we're also thinking of it as a way that many people cope, a way that uh, a whole set of resources for people, both internal and external, that lead to mental and physical health and well-being, helps them make meaning of their world. And this is true whether they are religious or spiritual or not religious or spiritual. Those become ways that people make meaning as well. So we see spirituality and religion as a diversity variable across the board, from having no identification with any spirituality or religion all the way to being having these things be very central in somebody's life. It really does affect people's sense of self and even just their whole understanding of reality. And so we know that our clients, the people that we serve, are spiritual and religious. The vast majority of people believe in God. Still to this day, even though attendance in religious services has declined quite a bit, 4 out of 5 people are affiliated with a religion, and 40% of people would call themselves very religious. And, again, vast majority of people would say that it's either very important or fairly important. And these are from general social surveys and random samples of the American public. And so this form of diversity and these aspects of people's lives are at least as important to their psychological, emotional, and mental health as other forms of diversity, as I was mentioning. They're also quite clinically relevant because participation in organized religion and spirituality, religious and spiritual coping, personal religious and spiritual practices all have robust, tens of thousands of articles showing their relationship to psychological well-being. And we know that religious and spiritual struggles and problems are also quite prevalent. And even recently, out in the public, multiple mass shootings have had problematic religious and spiritual elements. And so we really do need to pay attention to it as a profession. And as a profession in psychology, most psychologists are much less religious or spiritual than the clients they serve. And so like 75% of the public says their approach to life is based on their religion. Only 35% of mental health professionals do. And we have a really strong history in psychology of pathologizing religion and spirituality. So Freud, of course, says the whole thing is patently infantile, completely foreign to reality. It's so sad that people will never be able to rise above this view of life. Albert Ellis, who kicked off cognitive and rational behavioral therapies, has nothing good to say about religion and spirituality. And, behaviorists led by John Watson think it's not a great thing either. So there's been this kind of, from the very beginning of psychology, a little bit of a bias against these things. But we know today that so many people who receive mental health services and their family members, this is a great survey of a group of 2,000 individuals receiving mental health care services, saying that 80% of them agreed or strongly agreed that their spirituality was very important to their mental health. And so back in 2011, we started to work on how could we train therapists to address spirituality and religion in a more ethical and competent way. We did a number of interviews and focus groups and sort of Delphi expert panels and came up with a provisional list of 16 competencies. And I'm not going to go into those now because, as you'll see over time, these have evolved. But this was sort of like the whole universe of what would we really want psychologists and mental health professionals to know if we had our ideal. And these were published in this early book I wrote with Shelley Scammell, Spiritual and Religious Competencies in Clinical Practice. We continue to do more surveys with the field, now trying to figure out, okay, those of us who are experts and geek out on this topic think that there should be 16, but what does the general population of psychologists and mental health professionals think they need to know? So we asked them a lot of questions about what do you think mental health professionals should be required to receive training in? How much training did you get? And how important do you think each of these are? And that's allowed us to kind of hone these competencies down to a set that we think are very basic and very relevant to practice. You can also look at a recent article in 2022 by myself and David Lukoff, who was the co-author of the Spiritual and Religious Problems DSM-5 now category. And this is just an overview of spiritual and religious competencies in psychology, where we are now, and what we need to do next. And so Division 36, now we've created a task force to develop professional practice guidelines for APA to propose that they adopt for addressing spirituality and religion in psychology. And these are the members of our task force. We've been working on this for about 5 years. And the purpose is to develop these competencies. And right now we have a full draft. We have somebody on the line who has been helping us with it, fresh eyes, Kevin Armstrong, and one of his students has been taking the most recent look at it, and the next step will be to collaborate with APA divisions to gain feedback, and then we'll submit it to the APA Board of Professional Affairs, and hopefully they will be adopted to help people understand what they could be doing, what they need to learn. And so over the last few years, we've been engaged in the Spiritual and Religious Competencies Project that I mentioned earlier, that Joe Currier's the primary PI of, and it was a collaboration between 5 different universities. And over time, we have worked very hard to scale down those 16 competencies into these 6 domains. And Joe's going to go in depth into these, but I'll just mention them briefly, that Number one, people who are in mental health care professions would inquire routinely about somebody's religious and spiritual background, belief, and practices, that this would not be something you would wait for the patient to bring up or the client, that you would always ask about it. That mental health professionals understand that spirituality and religion are distinct yet overlapping expressions of human experience and core areas of diversity and identity, that they do their own personal work and look at how their own spiritual and religious background or their background of agnosticism or atheism has influenced their attitudes and perceptions and assumptions about their clients and their religion and spirituality, or even just how they move through life. That we know that religion and spirituality can offer resources and strengths, and so people would understand what those are and how to help their clients access the ones that are important to them. But mental health professionals would also know that there can be problems and struggles, and we don't expect them to be experts in helping patients navigate or practice these things necessarily in session, but they should have the ability to recognize them, identify them, help their clients explore them, but practice within the boundaries of their competence and refer to or collaborate with spiritual care professionals such as clergy or other qualified individuals, spiritual guides, meditation teachers, or psychologists or mental health professionals that have some expertise in this arena. And so to us, that's sort of kindergarten level, but to the field, this is really challenging. This is like elevating to a much higher level of competency than the field is necessarily comfortable with. Having said that, we have now done so much work on trying to make sure that people who are not into all this stuff would be okay with these. And now we feel like we've reached that level where people feel like, yes, these are important. I would be okay with putting this in my program. I would be okay with being trained in this. And I wish I had been, is what most people say. And this is all within a context of, the work on cultural humility and the multicultural orientation, that the old ideas about competence in diversity were that you should become an expert in as many of the possible things that you might see as you can, or at least have a little bit of knowledge, let's say, in every religion, which is how I was taught. When I was taught any kind of religious and spiritual competency, it was like, here's what Buddhism thinks and here's what Christianity thinks. Now we know that the skills really have more to do with cultural humility and cultural comfort and taking advantage of cultural opportunities the same way they do in other arenas. So cultural humility, as you guys know, is not that we become completely competent about it. It's just that we gain appreciative knowledge about another cultural or religious identity. We engage in the process of exploration and that we're really open-minded. We're willing to engage in self-reflection, growth, a commitment to treating others with respect, celebrating and honoring diversity, and we can sort of be somewhat at ease and relaxed and open when we're discussing these issues in therapy. And then taking those opportunities when somebody does say something about it to explore more aspects of this aspect of their life. So often, what clients tell us in our surveys is that I brought it up, but it was never followed up on, often because the mental health care professional doesn't feel competent or capable of following up on it. And really, it just boils down to kind of genuine curiosity about what's going on with someone. So, in the last few years, we have continued this work, figuring out how can we get these into training? How do we get these into graduate programs, um, practicum, internship, and continuing education. And so we've created a roadmap by which several people from lots of different levels, all the way from professors to deans to program chairs to licensing exam professionals, accrediting bodies, people who were very much not excited about bringing spiritual or religious competencies into mental health care training programs, and people who were very interested in it. And we think we did a pretty good job of coming up with how we might be able to train people. The barriers and concerns that people out in the field have about training new professionals or existing professionals in these domains is that they just don't feel like they even have any room in the curriculum. There's so much that they already have to teach. They don't feel like they have competent faculty to teach it in their program. They're hesitant, and sometimes there's hostility from faculty and administrators saying, they don't think that they should teach things that are non-scientific, they would call it, or imaginary. They are concerned that if they include this, it will lessen training and or emphasis on other areas of multicultural diversity. And of course, there are some concerns that there's like a hidden agenda and some kind of evangelicism happening. They're also concerned about perpetrating or alienating people because of some of the injustices and oppression that have been supported by several world religions, or that religions and spiritual traditions have been used as a way of justifying these things, even if they themselves don't believe in them. So this is kind of what people are concerned about. So what we've been working on is defining the basic facets of the competencies that we want to teach, demonstrating the evidence for them, the research evidence, not that they're just opinion, but we know that these things are helpful because we have evidence, establishing some teaching guidelines and providing professional development, providing high quality training resources and materials, which you can find a number of those on our website now, and then influencing licensing and accreditation standards so that they do require this for internship programs and other kinds of programs. So you can find our training roadmap here, and hopefully this will be helpful if you are in a position to be able to influence training guidelines. And at this point, I will turn it over to Joe, and I think we'll go ahead and leave the Q&A for the end. Joe, does that sound like a good plan?
Sounds great. Thank you, Cassie. All right. So I've been tasked with kind of giving, a bit of a crash course, through, the 6 competencies that Cassie introduced a moment ago. As we, kind of think about defining, spiritual religious competencies, I think here would be some of the key distinctives about like what we intend them to be, and then also like what they're not intended to be. Right. So I would imagine that most of us, who are here, on this call, that these competencies would be pretty rudimentary, and basic, right? And I think it's important to highlight that as we think about, sort of, moving the field forward, like we're really talking about kind of foundational generalist competencies that we think, are going to apply to all psychologists and possibly other mental health professions as well. Most of us here have gone above and beyond these 6 competencies, right? And we've maybe even, developed specialized expertise, in attending to religion and spirituality in our practice of psychotherapy or other clinical practice activities, right? So as we go through these competencies, like I would encourage everybody, think about the colleague in the office next to you, that you might have a good friendship with, but is maybe a little bit skeptical, about what we do in this division, and is maybe, a little bit ambivalent about, attending to religion and spirituality, right? So you want to be thinking about, those persons in your professional network or community, department, clinic, who, may not share the same kind of specialized interests as we do here, in this department, or I should say in this, oh, I got it for here we go. All right, so I'm going to, go very, very quickly through these competencies just because I want to make sure that we have time for rich discussion at the end. So, as Cassie has already highlighted, the first, guideline, I'm going to go in a little bit of a different order, that Cassie went in a moment ago. And in some ways that just shows that this is pretty fluid right now. And this is pretty much like, we're still like, we do not have everything ironed out right now, and that these competencies, are subject to change, Right. So the first, competency, or in APA terms, this would be a professional practice guideline, would be, that psychologists have the ability to define religion and spirituality as related but yet distinct aspects of diversity, well-being, and psychological functioning. So as we know, there are virtually hundreds of definitions, in our mental health literature right now. These are just two of the definitions that I find to be, particularly helpful. They come from Ward Davis and colleagues' recently published Handbook of Positive Psychology of Religion and Spirituality. Um, but like we know, that there's a large contingent, of, our society, who would identify as religious and spiritual. There are people who identify as religious but not spiritual. There's a growing percentage of folks who identify as being very spiritual but not religious. And then there are folks who might not identify with either religion or spirituality, but for whom, like, this is still going to be, a clinically relevant area that we need to possibly attend to, right? So, like, what might be some of the the signs of someone who's really pursuing this guideline seriously? I think first, I mean, ideally, psychologists like will appreciate the fact that that we do include religion in our conception of multicultural diversity within the American Psychological Association, right? So these would be quotes from the APA Ethics Code, the standards of accreditation for health service psychology programs, as well as, the APA dictionary. And you can see that, religion, in all instances, and sometimes spirituality will sort of make it into the list of the family of the different sources of diversity, right? But we know that in practice, kind of religion and spirituality are a little bit like, maybe that third cousin that you see, maybe, every few years at a holiday gathering, and maybe you enjoy seeing that person. You don't have any issues with that person, but that maybe that family member doesn't necessarily factor too much in your day-to-day life. And in some way, like I would say that that's generally kind of like mainstream psychology's posture toward religion and spirituality right now. I think we've come a long way. I think psychologists are generally open, to religion and spirituality, much because of research that people in this division have done and the way that we have represented to the broader field. But yet, these are areas that don't necessarily get a lot of attention or engagement, in our profession. Also, I mean, ideally, psychologists will understand that, spirituality and religion are highly prevalent, in our society. Cassie, shared some statistics already, and these are uh, percentages of different aspects of religiousness and spirituality that come from Harvard's Consortium for Psychosocial Stress, Religion and Health. And if you look at these different types of beliefs or different types of spiritual practices, I mean, you'll see that, across major racial ethnic groups in the United States, there's a very, very small percentage of persons who would not identify as either spiritual or religious, right? So if we use these numbers, we're looking at roughly 95% or more of the people that would come for care to psychologists, right? So these are highly prevalent areas, of diversity and well-being that, that ideally, psychologists are gonna, know about. I think as Cassie highlighted, another key guideline, would be, as psychologists, that we know ourselves, with respect to our own backgrounds and attitudes toward spirituality and religion. So ideally, in the same way that we're hopefully, uncovering, our implicit bias, for other areas of diversity, such as race, sexual orientation, the list goes on. Ideally, we're going to have that same disciplined commitment to cultivating self-awareness about spirituality and religion. Right. So, like, we're going to ideally know and recognize, when, we're possibly over-identifying, with the clients that we care for, right? That, it seems, a little bit counterintuitive, but from a multicultural standpoint, the most dangerous sort of situations, are when like we think we have similarity with the people that we're caring for, right? So if I'm a devout, Catholic, in my personal life, and I'm caring for another, Catholic client, like I'm going to tend to make assumptions, about that person, right? Or maybe if I've had negative experiences about religion and I'm caring for, a client who's experienced spiritual trauma, I might make certain assumptions, right? That ideally, like we're going to be able to, to understand our backgrounds, and we're never completely bias free, but ideally, like we're going to have enough awareness where we'll be able to give every single person who comes to us the fullest opportunity, to get, high quality and hopefully spiritually responsive care. So if you think about, like the different dyads that would emerge, I mean, there can be situations, where there's maybe a religious client working with a religious person. You have matching in religiousness. You can also have matching in secularity. I think, as a, faculty member in an APA accredited training program in clinical counseling psychology, I think this dyad of, kind of secular clinicians working with secular patients is very, very common. And I can, tell you on a number of cases, in which, students who come from secular backgrounds underestimate the importance of spirituality to their clients because maybe it hasn't been important to them, or cases when, maybe a religious, clinician is working with um, another religious client, and then they might make assumptions that they might want to incorporate their faith or spirituality in the process because this is what they might want in their own treatment. And that's, unfortunately, you know, not necessarily going to allow for, effective care. I think guideline three, would be, as psychologists, that we appreciate, the different ways that spirituality and religion can provide strengths and resources, in people's lives. So I think one of the just the most encouraging and major advancement, in our profession, over recent decades, has entailed the serious, rigorous research, that has uncovered, different ways, that spirituality and religion, one, can reduce the risk of developing mental health disorders. But then when mental health disorders occur, in people's lives, we now know through research that many people turn to faith and spirituality in really helpful ways, to draw strength and comfort, and that also, spirituality and religion can also be part of, the healing and recovery process, for many people. So these would just be some of the, the review articles, that have been published, that have, really kind of told the story of where we are, in terms of the state of the science, with respect to, mental and physical health related benefits of religion and spirituality. Um, so as we think about, psychologists, hopefully, being aware of different ways that spirituality and religion can provide strength and resources, and being willing to then harness or attend to these strengths in their clients' lives when they can occur. It's important, to understand kind of the ways that, faith or spirituality may function differently, in these ways in different people's lives. So this is a quote from one of Ken Pargament's articles, that was really helpful for me, right? So it's not, adequate to only know that a client is religious or a client is very religious. That ideally, when it comes to attending to strengths and resources, we need to go beyond that, and we need to understand how religion is involved, in their lives. Who does their faith, their lived experience of religion or spirituality consist of? What do they do? When do they do it? Where do they do it? right? And then, as Cassie has already highlighted, what are the psychological needs or functions that, religion and spirituality is possibly meeting, for that person? Is it social connectedness? Is it meaning making? Is it coping? Right? The list can go on. You know, we also know, I mean, and hopefully, psychologists will understand this, that there's a, pretty sizable literature that, that culturally adapted, psychotherapies, that have been designed, for, attending to strengths and resources for different religious groups, that there's an evidence base, for these treatments now. They're equally effective, to the standard forms of those therapies in terms of reducing mental health symptoms and other psychological outcomes, and they're more effective in promoting spiritual outcomes. So like how would a psychologist, ideally harness, spiritual religious resources, in their clients' lives? I don't think it's feasible that every single psychologist is going to get training in implementing spiritually integrated psychotherapies. Many of us here, this may be our bread and butter, but this might be a bridge that's too far to cross for many psychologists. But ideally, hopefully, all psychologists would have the ability to tailor, treatment, according to, their client's spiritual religious beliefs when, it would benefit the client, right? So here would just be kind of some of the tips, for doing so. I mean, you'll see these are pretty basic, fundamental, practices. Take a deep breath, know yourself, give yourself permission, simply to apply the skills you already have to, spiritual content and, spiritual kind of experiences that your client is having, right? So, expanding your empathy and your cultural humility to attending to the spiritual and religious aspects of people's lives, right? So we may not necessarily even need, psychologists to necessarily learn this entire new set of skills. It's just sort of expanding their frame of reference, right? They're probably already attending to strengths and resources. Just expand your frame of reference to recognize that spirituality, religion often, really shapes the ways that people cope, and persevere and keep going forward and heal and recover. Um, so that would be the good news about spirituality and religion. The bad news about spirituality and religion is that, for many people, it can also be a source of, tremendous pain and struggle. So I think another kind of major advancement, in our scientific literature, has, entailed, work of Julie Exline, Ken Pargament, many other people now, to show, one, that many people, particularly those who are dealing with mental health issues, can really struggle, with their faith, their spirituality. So here would be some of the common struggles, that come from Julie's work, and there have now been, roughly, maybe 30 to 40, rigorous longitudinal studies, that show that when spiritual struggles are present, along with mental health symptoms, that kind of over time, those who are struggling with their spirituality and religion along these lines, they tend to fare worse over time from a mental health standpoint when you account for the severity of their mental health symptoms, right? So what does this mean? This means that, for people who experience these spiritual struggles, their chances of recovery are less than those who don't, right? So this makes it a highly relevant clinical issue for us. But there are other, problems related to religion or spirituality that, psychologists might encounter, that there's a growing literature on, spiritual bypassing, there's kind of passive, deferring strategies of spiritual religious coping. Scrupulosity is a unique form of obsessive compulsive disorder, that, is characterized, by kind of religious beliefs, perceptions, behaviors. If anybody works with, people suffering from, severe persistent mental illness, you'll know that many people, their delusions, hallucinations, are often kind of spiritually or religiously themed. We're learning kind of more and more, about, the frequency of spiritual trauma, and abuse. I mean, the list goes on and on and on, right? And these are clinical problems that, psychologists and other mental health professionals will encounter time and again, in their practices, right? So ideally, mental health professionals are going to have the ability to recognize these problems, and then to be able to distinguish these problems from, kind of psychopathology and possible kind of other forms of kind of impairment, right? So how do you do this? Like, I think, just a couple questions that ideally people would ask themselves, would be like, one, like, well, is this problem consistent with cultural norms? And how is this problem impacting my client's well-being and functioning at this time, right? So ideally, like psychologists, I mean, this is where like a psychologist may refer to a spiritual or religious leader, maybe a chaplain, maybe a colleague who might have, specialized expertise in this area. So it might be a bridge too far to cross that all psychologists will be able to deal or address these problems, but we need all folks to be able to identify them, we think. Just be some of the do's and don'ts, for, addressing spiritual struggles in day out clinical practice. This comes from Ken Pargament and Julie Exline's recent book, Working with Spiritual Struggles in Psychotherapy. I think it's going to become another classic. I encourage everybody to read it if you haven't done so already. Ideally, we don't want psychologists, to avoid, neglect, change the subject when spiritual, struggles, or other problems emerge. Don't assume, that, you understand, don't judge or criticize. I think there's this tendency, as psychologists, right, that if there's a belief or an area of life that's causing distress, right, that we often want to kind of, help our clients to get rid of it, right, to maybe have like a faithectomy of sorts, but we don't want to do that. We also don't want to slip into the role of overfunctioning and, trying to be a theologian or a pastor, right? But ideally, we want to inquire, explore, listen, normalize, and assume a posture of cultural humility, as Cassie has highlighted. Um, Collaborate, with chaplains, other spiritual care professionals, who might have the skills that the client needs. And then there's evidence-based interventions out there, like building spiritual strength and other interventions, to that you possibly could implement, if your setting would allow for that. In terms of, the skill-based, guidelines that we're suggesting, we're keeping things, pretty minimal. So you'll notice we don't have, we're not suggesting any guidelines, that psychologists will learn to implement spiritually integrated psychotherapies. But as Cassie already highlighted, like we do think, it's important that every psychologist, possible other mental health professional, has the willingness to like directly ask your clients in, caring, empathic, curious ways about their spiritual and religious identity, right? So, this would be kind of a three-phase kind of process, for how psychologists may do that. I think one, ideally, psychologists are going to broach, about spirituality and religion, hopefully, as early as relevant in the clinical or treatment process, right? And then depending on how their clients respond, ideally, psychologists are going to, respond skillfully in those moments in the same way that, hopefully we would respond skillfully, when broaching about, the significance of a client's racial background or sexual orientation or other, sources of identity. And then, as we, engage, our clients, in exploration, discussion about their faith or their spirituality, ideally, we're going to have the willingness, to include, those strengths or resources in the treatment, to tailor the treatment accordingly, according to our clients' preferences, which would be very much in keeping with evidence-based practice, or to possibly look into referring or collaborating with spiritual care professionals, clergy that we would address in the last guideline. So here are a set of questions that I think are pretty helpful. There have been a lot of really helpful books written on spiritual religious assessment. These questions come from Ken Pargament's book. But just imagine, the impact that what if every, psychologist, just had a set of questions that they've memorized, that they ask their clients kind of early on in the treatment process. Do you see yourself as a religious or spiritual person? Okay. If the client says no, that might be the end of the conversation. And you move on and you talk about kind of other clinically relevant areas in that person's life. If they say yes, you explore, well, in what ways? Like, what does it mean for you to be spiritual? What does it mean for you to be religious? Are you affiliated with a religious or spiritual denomination or community of some sort? In what ways? Again, it's not enough just to know that that person is affiliated with the synagogue or the mosque or the congregation down the street. It's important to know, well, okay, well, how often are they going to services, and how do they intersect with the people in their spiritual religious community? How has your problem affected you religiously or spiritually? Right? This is, kind of getting at, the possible presence of spiritual struggle or spiritual issues. How has your religion or your spirituality been involved in the way that you've coped, with your problem, right? Again, and then depending on the response, then probing, and exploring how has the client drawn strength or coped, with their religion and spirituality. Again, there's a distinction between implicit, explicit spiritual religious assessment. Here's some references, for books that do a great job of, disentangling these approaches. The sixth guideline, would, kind of entail sort of working within our scope of practice, as psychologists, and having the willingness to collaborate with clergy and other spiritual care professionals, when needed. So this would just be a continuum that I think for some of us, we might, be kind of more at the end of the novice. I think for most psychologists, they're going to be more at the end of the novice, for attending to religion and spirituality. Whereas some of us might have a background in theology, or we might even be something of a spiritual religious guru ourselves, right? But again, that introduces a whole other set of ethical challenges, right? To still function in the role of the psychologist. Here just be kind of some of the stumbling blocks, for collaborating with clergy, that psychologists kind of may encounter. I think a really great model right now, would be Glenn Milstein's COPE kind of framework. So I would, just encourage people to, to check out, Glenn's work. He's got some great principles, and actionable strategies, for overcoming, these barriers. I'll just, very, very quickly say that we've got a lot of research, basic research, about the mental health benefits of religion and spirituality, the ways that spirituality can also harm mental health. We're also doing really good about measurement. We're also doing good about kind of to move that research forward in terms of applied clinical research, like the intervention studies, on spiritually integrated psychotherapies. We still have a science practice gap for this body of knowledge. It's not making it into the mainstream like it could be right now. How do we overcome that? I would encourage everybody that as we identify these guidelines and these kind of universal kind of areas of practice that we would hope all psychologists would aspire to, the bridge is going to be promoting training in these areas. You know, that training is going to be the mechanism that really allows us to try to overcome this practice gap, you know, that right now we're sort of lost in translation, that our research is not making it into practice. And this is a universal problem, you know, across all APA divisions and, you know, other areas of scientific research. Again, I would just point people to our spiritual religious competencies website. There's a lot of resources for training on that website, including the roadmap that Cassie has highlighted. So I'm going to stop now, and I think we've saved 10-15 minutes for questions.
Thank you both so much. That was so interesting. I'll just invite anyone who has a question to raise your hand and we'll call on you. Yeah, go ahead, Chris.
Thank you. So my name is Chris. I live in Santa Clara County, home of San Jose, California, and I have been working on the California Mental Health and Spirituality Initiative, which I know David Lukoff is a part of. And we have in California, there are 4 counties that have adopted what are called spirituality policies. Those are Los Angeles, Alameda, San Mateo, and then my county, Santa Clara, in 2022. And essentially, those policies, that policy basically states that upon intake, a county employee or county contracted employee will ask about spirituality and religion. And we utilized some of the research work that your team has kind of put together, which is great. My question is anyone on here aware of any other kind of jurisdictions that are going that route of incorporating it into a government adoption, if you will?
That's kind of amazing. Yeah, the only thing I am aware of is the OSHA standards for hospitals across the board of hospital accreditation. So medicine is kind of ahead of mental health professions in requiring attention to these domains. So in hospital accreditation, you have to show that you are inquiring about someone's religion and spirituality, and you are providing religious and spiritual resources for them. Mental health is kind of far behind that, right? So, but it's interesting that during our whole road mapping, that didn't really come up, that there could be like a jurisdictional requirement, or at least a recommendation to do that. That's amazing.
Yeah, that's really inspiring. Yeah, so that would be a top-down way of trying to promote, systemic culture change. I think, as we know, top-down initiatives, can be very, very effective. How are clinicians, or mental health professionals responding to these mandates that they have now?
That's a great question. I find that effective things happen when change happens when top down meets bottom up.
Yep.
And
Yep.
because
Yep.
I mean, we have this policy now. I can't tell you if it's being implemented. I mean, I know that when we were putting the policy together, we utilized the FICA, if I remember correctly, as a assessment tool that the counties can use. And there was some training, but I think that's where the proof is in the pudding. Is the county through its systems, hospital systems, and healthcare systems actually incorporating the policy, and that's where I think some additional work needs to be done. But I do think from a policy perspective, at least it's there, and so that's the first step. But that's a great point of is it being implemented? I don't know. I don't know the answer to that.
Yeah, or how are the mental health professionals receiving it, right? Because sometimes we don't really like to be told what we need to do, but I love that image of the top down meeting the bottom up. And I do think there is consensus among most mental health professionals that religion and spirituality are important aspects of multiculturalism and well-being. And because of that, I think most people just want to do the best job they can. And if this will allow them to be more responsive, more effective, they're going to welcome it.
Do you know if there have been any surveys of the clients in those counties?
What they
thought about that?
I know that I think it was David and Anne Marie Yamada, I believe, did an evaluation of Los Angeles County's policy a few
Mhm.
years back, and I think that that's available. I know Santa Clara County; it's too new.
Mm,
It was 2 years ago that it was adopted, or 2.5 years ago. But
mm,
I don't want to dominate the conversation.
Yeah.
So
mhm.
if anyone else has other questions, but thank you.
Thanks, Chris.
Julie, you want to go ahead? And then Lehua.
So, first of all, thanks for this wonderful presentation. I have two questions that relate to the concept of time. It seems that at the moment, the emphasis is on the initial assessment of the client, and and I understand that often in research, you're looking for studies in which clients are presenting with one well-defined problem that is now going to be evaluated, at the end, for improvement. In clinical practice, which is my emphasis, exclusively. I'm not in a university setting. Um, often people are coming in with developmental histories, and so and also with problems, potentially multiple diagnoses. And the reason that they're there at the moment, the crisis for which they came in, may not be related to something that is explicitly spiritual or religious, but there may be developmental aspects of their experience, even if they don't currently consider themselves affiliated, that emerge in different nuanced ways over time. So I'm curious if the new guidelines and the teaching that's being developed, have look backs to the developmental impact of different types of not only explicit messaging, but also some of the structural features that happen when people grow up, with different types of religious experiences in their families of origin, and what is being encouraged about looking at religion and spirituality over the course of treatment and not only at the initial clinical evaluation.
Go ahead, Joe.
Um, so, so I guess it's kind of two questions about like maybe how we're attending to these issues of timing, in the professional practice guidelines. So I think, at this point in time, so for the section on, spiritual religious assessment, like we don't go into too much depth, about like, developmental experiences, and the possible role of like developmental trauma of a spiritual religious nature. Like, you know, like like we're very intentionally keeping the background section, somewhat lean and mean, and not, going into too much detail. I do think those are really important points. The question about like when to ask clients about their spirituality and religion, I think that's a very important question, right? So, so ideally, like, we're going to be training, psychologists to appreciate that assessment is a process in the same way that spirituality is a process, right? So it takes a process to assess and understand a process, right? I think, the first step is just having the willingness to ask clients about their spirituality and religion. But ideally, like psychologists are gonna, they're gonna have this knowledge about the double-sided nature of spirituality and religion, the ways that spirituality helps, harms mental health. And then on the basis of that awareness, they're gonna hopefully have the ability to be listening for spiritual themes and content throughout the treatment process. And when it emerges, hopefully they're going to have the courage and the skill to attend to those things. So it's not really a one-time thing. It's really going to be, driven by clients and, just the unique things, right? And in my experience is that clients often don't want to bare their souls in the very first session, right? And it can take time to build those relationships. And yes, and yeah.
Thank
Yeah,
you
and I
so
think
much. I don't want to
a
take time
lot
away
of
from Roy Haas.
yeah, and I think a lot of clients have had negative responses to their sharing about their religion and spirituality, so they don't feel very safe in the first session saying anything about it, even if asked. And so You know, I always like to use the phrase spiritual and religious backgrounds, beliefs, and practices. And I think that came from another set of researchers that escape me right now. And so spiritual and religious beliefs, backgrounds, and practices, I think, encompass better what we're talking about. There are also assessment tools like a spiritual religious genogram that people can do that tracks back over their own history and their family history and how it affected them. And there was in the initial set of competencies a competency that said psychologists understand that religion and spirituality develop and change over a lifespan. And that was kind of one that got axed as being a little bit too advanced to expect every single mental health professional to have expertise in. But I think you're absolutely right.
Yeah. Mhm.
Thank you.
See, we have time for, I think, 0.5 more questions. So I know, Leoa, you had your hand up before, and Pete, I see you have your hand up. If you want to just email the presenters after, I welcome you to start a conversation with them. But Leoa, you go ahead, and then we'll have like 30 seconds per speaker, and then we'll wrap up.
Thanks so much again for the presentation. I'm just wondering about, are there any systematic efforts looking at the process of developing these competencies? And I know Jen Ripley and she approached me and we worked on a presentation that we made at the National Council of Schools and Professional Psychology that I've been involved in, and I'm an educator. But I'm just wondering, is there any research? Because I think we need some, and I think that could be really compelling to our field.
And so you're asking, is there research into the process of developing the competencies?
Right, into emerging psychologists and clinicians learning these competencies and how best to teach it.
Oh, yes, yeah. Yeah, the most recent work we did with the Spiritual and Religious Competencies Project was focused almost completely on how to train and integrate. And so we used a dissemination and implementation science approach. And we collaborated with our DISC Institute on campus and had a dissemination and implementation scientist as part of our team for that reason. It was really fascinating to learn about how you shorten the time between, in medicine, they call it bench to bedside, you know, that the time between discovering and applying is something like 17 years, some insane amount of time. And so how to accelerate that is kind of where it's a good place to end, is sort of balancing top down and bottom up and making sure that all stakeholders have had a voice and been heard about their concerns and so that you can sort of bulletproof your strategy ahead of time so that by the time you're rolling it out, you've already heard most of the barriers and concerns that people might have. That's been really, really helpful.
Okay. I think if everyone's okay with that, we'll leave it there. We're 1 minute over, which is pretty good. So thank you so much to our wonderful presenters. Really, really spectacular. We will be posting this on the website in about a week, so you're welcome to rewatch it and continue the conversation. And I hope you all have a good night.
Thank you, Charlotte, for organizing, and
Thanks.
Connie.